This video shows dissection of small arteries from the rat intestine and the myograph mounting techniques. Use this video as an introduction to the techniques and as a visual supplement to the myograph course manual. Using similar techniques, other small vessels and tubular structures can be isolated and mounted. You will succeed with this technique through practice and attention to detail. We see here a rat mesenteric bed which has been pinned out in a petri dish that is coated on the bottom with a silicone compound. The tissue is immersed in cold physiological salt solution. The vein and artery run together, surrounded by a layer of fat. If you begin pinning the gut from the proximal end placed at the top of the dish and continue pinning counterclockwise, then the veins will lie on top of the arteries. The vessels branch out from the central superior mesenteric artery and corresponding vein. Close to the gut they branch further into an arcading system. Here you can see how much stretch you can use without damaging the vessels. In situ, these tissues will normally be subject to a substantial amount of stretch from the movement of the body. Some stretch on the tissue is necessary to aid the following microdissection. This microdissection is done with the help of a stereo microscope with zoom, a pair of trabecular scissors and a pair of fine forceps. The best technique for cutting is to hold the scissors so the blades move directly up and down and to make the cuts parallel to the vessel wall. The coarse microdissection starts from the first branch. Most of the fat and peritoneal tissue is removed, firstly from one side of the vessels and then on the other side, always moving towards the smaller branches. Note that by turning the petri dish, you can cut with the scissors at about the same angle all the time. During the coarse dissection, you should not get very close to the vessels. Throughout the whole procedure, do not grab any part of the vessel that is going to be used. Avoid cutting or pulling on the vessels or the vessel wall. The easiest technique is to hold the fat tissue with the forceps and pull, and then make the cut. For each small cut you make with the scissors, make an extra little stretch with your forceps. You can see that a lot of the fat is removed in this way. The branching is being investigated here to try and distinguish between vein and artery. In this instance the vein is lying uppermost. You can determine which vessel is which from the thickness of the vessel walls and the size of the lumen. The wall of an artery is thicker and firmer than a vein due to more muscle mass. If you gently touch the vessel walls you can feel the difference. The lumen of the vein is often larger than in the artery. The vein is being removed now together with a lot of the surrounding fat. As you cut closer to the artery, you need a larger magnification to avoid cutting into the vessel wall. When you get to the next branching point, you begin cleaning up and continue down to the third or even fourth branches. You will finally end up using the third or fourth branch vessel, but you will take the first or second branch also. The larger branches make it easier to mount the smaller branches onto the myograph wire. The magnification is further increased when you want to remove the remaining fat. Here you can see in detail how, by pulling with the forceps, you can remove the adhering connective tissue that surrounds the vessel with the fat. Now we are down to the third and fourth branches that run close to and send smaller branches into the gut wall. The fat and the connective tissue come off easily here because of the stretch of the bowel. There is a little drop of fat around the branching, which is being removed carefully. In general, you should not struggle too much with tiny drops of fat because you risk damaging the vessel. On the other hand, you would like to have the vessels as clean as possible, especially the third branch, but also that part of the larger branch which you will hold to mount onto the wire. Too much fat or connective tissue on a vessel makes it very sticky. Here the second branch is being cut away, leaving a little side branch that can be used as a handle to move the vessel to the myograph chamber. Finally, the distal end of the artery is cut, and you can closely examine the vessel. If you see small narrowed regions of the vessel, like sausages on a string, you should avoid using these areas since they reveal the vessel is damaged. Here you can see how the artery is cut as perpendicular as possible to make it easier to mount onto the wire. The small side branch is then grabbed and the whole vessel is transferred to the prepared myograph chamber. The vessel is mounted with two 40 micrometer wires through the lumen. These are fixed with screws on two mounting heads. One head is connected to the force transducer. The other is connected to a micrometer screw so it can move. The heads are suspended in the myograph chamber, which is initially filled with cold physiological salt solution. Here you see the mounting heads. The one to the left is connected to a micrometer screw. The one on the right is connected to the force transducer. The wires are approximately 2 centimeters long. They should have blunt ends and be as straight as possible. The first wire is grabbed with the forceps 1/3 from the top and with an angle of around 45 degrees. It is then positioned and fixed between the mounting heads as shown. It should be placed between the heads so that there is enough wire on each side to reach the mounting screws. The top end of the wire is now bent and placed under the top left screw head, which is fixed gently with the screwdriver. The vessel is moved to the bath and placed near the wire. The lumen of the vessel often closes when it is cut. To open it and to get a good grip of the vessel, grab it firmly with the forceps as close to the proximal end as possible. The wire tip can also be used to open up the lumen of the artery. You now thread the vessel onto the wire. Once the wire is inside the lumen, the vessel is slowly and carefully drawn up the wire so as to avoid damaging it. Take special care when the wire tip is passing the branching points. When the distal end of the vessel reaches the wire tip, it is pushed onto the wire. The end of the vessel is closed from when it was cut, and if you tried to pull it onto the wire, it could stretch the vessel and induce a contraction. In order to have enough space for the artery to pass, the heads are moved apart and the wire is bent out. The vessel is now gently pulled further up the wire. The vessel is adjusted to bring the distal part into the gap between the mounting heads. With the screwdriver pressed against the wire, the vessel is held back and positioned in the gap. The artery should be able to move freely in the longitudinal direction, and therefore it should not be clamped between the lower parts of the supports. The heads are moved together to clamp the wire. Then the wire is tightened with a pull, bent to the lower left screw and fixed in place. It is important that the wire is tight and follows the support all the way. Notice that the screws are turned in clockwise, so to tighten the wires, when tightening the screws, you always place the wire clockwise around the screw head. To get a second wire into the lumen from the top end, you need to remove the part of the vessel that is not in the gap between the jaws. This can be done in two ways. The first way, which is shown now, is to close the jaws and use a pair of forceps to rub the tissue away. The part of the vessel between the jaws is fairly secured when using this method because the heads are together. You can see that the excess tissue is rubbed and thereby freed away. The excess tissue can be left in place or can be cut away, as shown here. This method has the disadvantage that there will be quite a lot of tissue left at the top of the jaw, and if that is not dealt with, it will substantially affect the normalization. Here the second method for removing excess vessel is shown. You should imagine that the bigger vessels were still here. These will now be cut away instead of rubbed apart. The myograph heads are widely apart and you use a large microscope magnification. With the forceps and scissors, you carefully hold the vessel, pull it in the horizontal plane and make small cuts in the vessel until it is freed. To perform this method, you need quality sharp instruments and steady hands. Take care not to pull the vessel longitudinally or to cut the wire. It is important that a part of the vessel is still fixed between the support and the wire in order to hold the vessel in position when you put in the second wire. The result of the first part of the mounting is shown here. You have the vessel fixed at the top end, but at the distal end it can move freely in the longitudinal direction. Now the second wire should be introduced into the lumen. You can use the first wire as a guide. The best mounting will be if you, in one movement, can get the wire through the whole length of the vessel, of course in a very slow and controlled manner. When the wire has gone through the whole length of the vessel, you can let go of it and pull it the rest of the way. If during any of these procedures you observe that the vessel is contracting or providing resistance, do not force the wire through, as you will damage the vessel. In our experience, what you can do in this situation is to let the vessel rest for a while. Change to new cold physiological salt solution and resume the procedure after a break. When there is sufficient wire pulled through to reach the screws, the jaws are moved together to clamp the wires. Place the second wire underneath the first wire. If the second wire is on top, you easily risk that the wire slips upwards and destroys the vessel. Here the wire is bent around the screw and the screw tightened. Remember that the transducer is very sensitive to pressure at the transducer head, so do not use much force when you tighten the screws. This also applies any time you have the heads together. Do not turn the micrometer too far in. Next, bend the top wire around the screw head. Before tightening it totally, move the heads a little distance apart to allow the wires to be tightened. Now adjust the wires so that they are parallel and at the same horizontal level. If they are not parallel, you have to move the wires. Take your forceps and move the wires as shown here. Moving the heads back and forth makes it easier to see how the wires are positioned. This is how the mounted preparation looks. A small amount of tissue remains at the top end. The vessel fills out most of the 2 mm gap. The wires are parallel. The vessel can move freely in the longitudinal direction. Moving the wires in and out a few times allows the vessel to fall into its normal position. Now the heating and gas bubbling can be switched on and the vessel left to equilibrate.